Hope everybody's had a great day today. Let me see if I can tag some folks right quick. Let's see. Alrighty. Yeah, I hope everybody's had a great day today, in spite of the rain. It's been an ugly day out. I put my little heads up about tonight's live on earlier today, and I did a little singing talking about a storm out on the ocean, and it's moving this old way. Trust me, we're going to talk tonight about coronavirus, and I guess something that I really believe firmly in, and that many of the actual experts, I'm not an expert, don't claim to be, the epidemiologists, the scientists, they believe that for areas that have not been hit in the way that New York and New Jersey and New Orleans and Chicago and Detroit and other places, the way that they've been hit, it's believed that those areas that haven't been hit like them will be hit by this virus eventually. And so I've just come from my studying of this since right around March 12th, March 10th or so, of this predator, this tragic virus that has wreaked havoc around the world. I pray that I'm wrong about what's going to happen here, what's coming. But on the real, I don't believe I am. And I'm going to talk about it tonight as to why I don't believe that I'm wrong. Again, I'm not an expert. But I'm not exactly the slowest person when it comes to reading signs either. Okay? And looking at trends either. So let me get a few more people tagged here. And we're going to rock and roll from there. Okay. Please, I would ask everybody that is tuning in to please share this out to others so they might also tune in. Because the unfortunate part of this whole thing is that many of you have been with these lives for a long time. There are many people out here who don't believe that this is real, that the coronavirus is real, and that it's a killer. Much of it has to do with the information that was put out in the opening days, in the opening weeks. Misinformation, talking about this virus only attacked the elderly, and that, young people were good to go with it, and that black people were not susceptible to it, and all kinds of different foolishness that, if you really studied what was going on overseas with this before it got here, we would have known that that's not really the case. So we had a lot of misinformation put out, a lot of people who kind of downplayed the severity of this virus. And because of that, now there are a lot of people who just don't believe, who still don't believe, unfortunately. And as long as we're in a period right now where the death toll locally, and when I say locally, I mean in South Carolina, the death toll in South Carolina has not spiked. And we have people in our local government and our hospital community talking about we've beat the curve, when the reality is we haven't even come into the curve. And then we have political figures who are in charge of our state who are under the assumption that we somehow have beat the odds that others have succumbed to, and are opening up stores and business as usual, basically, with an underlying thought, stay at home. But who's going to stay at home? Especially when they got a little extra change in their pocket, folks going out. But all of those things together have lended to an attitude among the people of, this ain't that bad. But let me just tell you this, it might not seem this bad right now, but there's a storm out on the ocean, and it's moving this old way. And the bottom line on this whole thing, just as I put on my Facebook flyer, when I put it out there, I sincerely, and I've said it consistently on my lives, I sincerely hope and I pray that I'm wrong about this. Okay, alrighty. Well, I think that's going to be enough tagging. I've been at this for a minute here. Okay, alrighty. Okay, excellent. Get nephew in there and we good to go. Alrighty. Alrighty. Good evening, everyone. It's good to see folks. Alrighty. Alrighty, yeah. Sherry and Sonny. Sherry and Sonny. All right. Good to see you. Benny Gardner in the house. Good to see you. Mame Cornell. Good to see you. Faye, I thank you for your faithfulness. That's for sure. You know, for those who don't know, Faye knew me when I was working as a prep cook over in Vickery's when I came out of the prison system. That's where we met. We used to have meet at each other or see each other at Alex's over in Mount Pleasant. That's where I would wait until it was time for me to go to work because I couldn't drive and my license wasn't renewed at that time. So my wife would drop me off there at Vickery's on her way to work at MUSC. And then I would meet her. I would catch the bus back over to MUSC to meet her whenever I got off from work until she got off from work, but she was on 12-hour shifts though. But that's where Faye and I became friends at, and she's been following ever since. And I really, really do appreciate you, Faye. Thank you so very much. Julius, what's going on? Yeah, please do share out over stress elimination, man. And I love your page too. Gives me a reason to smile. Michael, how you doing? I have to ask how to pronounce your name. Okay, is it Shoban? Okay, that's a good try, I hope. But please inbox me with the correct pronunciation, because that's that one thing I hate to do is not pronounce people's names properly. Okay, it's to me it's like disrespectful. Okay, Missy, good evening. How are you? Good to see you. Dr. George Hopkins, my friend. George, I know you be like, man, where you coming from with that doctor thing? George, how you doing? Good to see you. Sid, how are you? Good to see you. Karen Cordry, good to see you. North Charleston's finest, that's for sure. Man, love you and the job that you do. Siobhan, thank you. Thank you so very much, Siobhan. Okay, I'm going to make a note. Make a note. Yes, excellent. So apparently I do have good audio and video. And we're going to just keep it moving tonight because a lot of this has been information that I've put out before. But the one thing that's always changing, it's ever changing, is to update information. Deborah, good evening. Good to see you. Good being on the Zoom yesterday with you. Peggy, how you doing? Rosamunda? Yep, good to see you. But yeah, most of the opening information I'm going to do is going to be dealing with just the numbers. And because those change all the time, unfortunately. I'll be glad when the numbers start going down, but unfortunately they're not. And that's why I don't understand at all the position that our governor is taking, that our mayor in North Charleston is taking, that others are taking, where they're dropping their guards and their defenses as if this thing is going away, as if the numbers are dropping. The reality is these numbers ain't dropping. These numbers are increasing, and they're not only increasing here. They might have, New York is doing better right now, but New York is in a different place from us because of when they started. Their problems started before us, like China. It started in Wuhan, China. And when their numbers started to decrease, as the numbers started to increase in Italy. As Italy was rising, the numbers in Spain started to increase, which was just west of them. When Spain started rising up, the numbers in the United States started increasing. And one of the first places and the worst places that it started was in New York City. And that was long before we even started numbers to rise here in South Carolina. Thank you, my brother. Nice shirt. All right. I appreciate you. Jesse, what's going on? Cynthia, how are you doing? All righty. Aaron, hope you're doing all right. Yes. Jackie, what's going on? All righty. Michelle. So the numbers And the data that we look at that happened in New York started on a specific point with the first death, okay? At that point was weeks ahead of us. And that's why they've come to a spike in their curve before us. So we can't gauge what's going on here by what's happening there. And a lot of times when we listen to Dr. Fauci and the others who are the national experts, he's a noted epidemiologist, and I respect him immensely. But sometimes the conversation seems like it's a general conversation when the reality is those curves that he's talking about are in specific locations like New York. When he says we're flattening the curve, or we're looking better, or we're coming out of the curve, he's not talking about everywhere in the United States. He's not talking about South Carolina. At least this is my opinion as not being an expert. And I sincerely hope that I'm wrong. I do. Katrina, good evening. Good evening. I truly hope that I'm wrong. But let's look at the numbers, okay, as we move forward. How have things changed? All righty. And I'm going to do like I usually do. I'm going right back to the beginning, which was the beginning as far as the United States, and our first death was on March the 1st of this year, 54 days ago. Now, there's been new information coming out of Southern California that there were a couple of other cases prior to that, like mid-February or something like that, when of coronavirus, that this is new information that's coming out. And there's not a lot of information about it. They just said, okay, we found that there were 2 more cases. So even so, when we stop and we look at the numbers from the first case in the United States until where we're at, we can move the date back or whatever, but that's not going to change the numbers today and what they're going to be tomorrow. It's not going to change it at all. Okay, the numbers are really going to continue to rise until we really get this thing under control. And how do we get it under control? By not dropping our guards nationally. Because if Georgia drops their guards and we have our guard up here and people from Georgia come here, they spread the virus further here. If we drop our guards here in Georgia and then somebody here takes a trip back up north, you take the virus there, So no matter how good somebody else is maintaining themselves, there's always the risk of others bringing the infection in because of the area they live in being slack about how they handle their business, like South Carolina. Okay. I pray everything is well with your mother, Jesse. That's for sure. Okay. Let's see. Shaunalia, good to see you. Nisi, good to see you also. Erica, what's going on? Millicent, what's happening? Great Zoom yesterday. Great Zoom. Yeah, 54-year-old healthy woman. For sure. Yeah, Siobhan, antibody testing in New York says 1 in 5 have had it. I got a theory on that. Okay, of course I'm not that expert, but I tell you what. It seems to me like this thing is airborne a lot more than what they're saying, because when we look at the rate of infections, where the people are getting infected by that, and it's not necessarily somebody traveling to these places. It's just folks coming down with it, So I don't know. Let me keep on rolling on this. Okay. 54 days ago, 8 weeks ago, that's 8 weeks, March 1st, that was our first coronavirus death in the United States. All righty. 2 weeks later, on Monday, March 16th, we had 85 deaths total. Okay, it went from 1 on the 1st of March to 85 15 days later. 30 days after that, okay, 1 month later, 30 days after that, on Wednesday, April 15th, those 85 deaths had grown to 27,085 deaths in 30 days. 27,000 deaths in 30 days. Come on, somebody. Yes. And that 27,085 deaths, that was 8 days ago. That was last Wednesday. That was that was a week ago yesterday, where we had 27,085 deaths. Okay. 4 days ago, if you all remember, I was on live and I brought the numbers up. That was on Sunday. And that was 50 days after the first corona death on March 1st in the United States. And on Sunday, the national death toll had risen from all the way up to over 40,000 people. 40,300 or something like that. I incorrectly reported on Sunday that it was 41,379, and it was incorrectly reported because CNN put it out that way. I took CNN as what they said, and then they backed it back later on, either that night or that next morning. They backed it down to over 40,000 deaths in the United States. But just think about it. That Wednesday, the 15th, it was 27,000 dead, 27,085 dead. By Sunday, it was over 40,000 dead in 4 days. That's crazy. That's crazy. But that was 4 days ago there with over 40,000. Anybody know what the death toll is right now? Chef Cheryl, how you doing? Good to see you. Right now today, as of a little over an hour ago, I think it's high. I know it's higher than this right now, okay? No sense in me even saying I think it's higher than this. Death toll right now today is 47,272. 47,272. It was just 40,000 4 days ago on Sunday. And it's 47,272 today. 7,000 deaths, 7,000 plus deaths in 4 days. That's crazy. It's nearly 2,000 deaths per day since Sunday due to coronavirus. And all these people are saying, well, they just adding in numbers and blah, blah, blah. No, they're testing these people. These people are being tested and proven that they have have this virus, and they died because of complications due to the coronavirus. Let nobody tell you they just adding up some numbers or whatever. That's people making an excuse that ultimately going to either set themselves up or somebody else up to wind up in a body bag with a toe tag. Yep, it's tight, but it's right. That's Pastor Dixon. That's what I do. That's what I do. Dolores, good evening. JD, what's going on? All righty. I hope everybody's being safe out there. Okay. Yeah, so we went from Sunday with just over 40,000, 40,300 some odd deaths to 47,000, over 47,000 deaths today. Okay. In 54 days, though, in less than 8 weeks, 47,000 plus deaths. And we're on our way quickly to 50,000 deaths. These numbers are rising. That's why, again, I say I don't see how in South Carolina we think we've overcome. We sing, we like marching in the 60s. We have overcome. We ain't overcome nothing. The trends suggest that we are still in the upward curve. I don't care how it's leveled off in New York. Man, we ain't got there yet. And I'm going to show you exactly how. We ain't got there. The way the numbers look right now, the average number of deaths per day in 54 days, take the 54 days, take the 47,000 plus deaths we've already had and divide those deaths by the 54 days, and we come up with approximately 860 deaths per day. If we project that out to a 365-day year, in 365 days at that rate, and of course, every time I do this, I do that, and the daily rate keeps going up. I remember the first day I did it, the rate was like 400 and some odd a day. Now it's 860 a day. Okay, and it's going to keep going up until this thing gets under control. But if we project this out over a 365-day period, a year's time, that'll be 314,000 dead Americans due to coronavirus. 314,000 dead Americans due to coronavirus. If we just expand it out. And like I said, that's only the number today. Every day the numbers are going up. Since Sunday, 7,000 people in the United States died because of the coronavirus. It's crazy. Janice, how you doing? I pray that you're safe and well in Chicago. Doing well, my sister, okay? Dana, good to see you. Thank you for tuning in. But that's on the national level, okay? Once again, let me just say it. Today's date, about a little over an hour ago, the death toll in 54 days, with the first death being March 1st, 54 days, less than 2 months' time, less than 8 weeks' time, there's been 47,272 deaths attributed to coronavirus in the United States. People who were planning on vacations and weddings and bar mitzvahs and making Hajj or whatever they were planning on doing no longer have that option to do them because coronavirus not only infected them, but took their lives. Okay, this is a reality. But what about South Carolina, where we're at? The place where our governor said, drop the guard, let it down. We're good, And we have healthcare professionals here who are for some reason or other telling the public the same thing, okay? When the reality is, and I sincerely hope I'm wrong, the reality is that we ain't got to where we're going to be as far as the death associated with coronavirus, COVID-19. We haven't gotten there yet, but we're dropping our guards. Here's a timeline for South Carolina, okay? We had our first death attributed to coronavirus, confirmed attributed to coronavirus on March 16th, Monday, March 16th, okay? That was the first one. That was 38 days ago. Okay, 38 days ago, 7.5 weeks ago, okay? 25 days later, which would have been last Friday, a week ago, Friday, April 10th, okay? On April 10th, there was 72. So in 25 days, from March 1st until April 10th, March 16th until April 10th, there were 72 deaths in South Carolina. That's if you lost somebody during that time, you can't say only. It's only that many, okay? That's something big for everybody that lost somebody. And the way people are dying, it's tragic because many are dying alone. They don't get an opportunity to have their loved ones around them as they transition from this life to the next. And the loved ones don't have a chance to even say goodbye in person because of the communicability of this virus, this pathogen. And it's too risky, even for the healthcare workers that are there tending them now. I think some of the hospitals now are trying to make it so at least they have access to iPads or something so there can be some FaceTime with the loved one before they transition for those that are leaving. Okay. Yeah. Charles, good to see you, my brother. Okay. Brian, good to see you also. So 38 days ago, in 7.5 weeks, okay, March 16th, we had our first death. Okay, 25 days later, that number had jumped up to 72. Okay, 72 in 25 days. Okay, now last Sunday, 4 days ago, 9 days after I had reported on April 10th that we had 72 deaths in South Carolina. 9 days after I reported that we had 72 deaths. On Sunday, I reported that the death toll had now reached 119. So we went from 72 deaths to 119 deaths in 9 days. 119 total in South Carolina in the 34 days since our state's first coronavirus death on March 16th. And 47 deaths, 47 of those 119 deaths were in the previous 9 days from the 10th of April until last Sunday, the 19th of April. We had a little tick. Okay, we had a little tick. Things went from 1 death or 2 deaths a day. I think we had one day we had maybe 3 or 4. Okay, then down to 1. Then nobody died, and it was just sort of traveling along right now. Then Sunday, all of a sudden now, we went from Wednesday till Sunday, we started to ease on up this mountain a little bit. Ease on up this mountain. And again, I emphasize, 47 of the 119 deaths as of last Sunday happened in that 9-day period between April 10th and April 19th. And remember, we had 72, in 25 days, we had 72 deaths, okay? Now we had 47 deaths in 9 days, okay? Now today, what's happening today? This is 4 hours ago, around 4 o'clock this evening, okay? And here we are, from last Sunday, we're 4 days from then. 4 hours ago, the state news reported that the COVID-19 coronavirus death toll in South Carolina has now jumped up to 150. We went from 119 to 150 in 4 days. That's 31 deaths in 4 days now. 31 from Sunday until today. We had 47 deaths in South Carolina in that 9-day period from April 10th to April 19th. 47 deaths in 9 days. And now we had 31 deaths in 4 days. Things ain't looking too good there. Things looking a little bit different. Seems like we're starting to go up the hill a bit. Okay? Seems like we're trending northward in this possible curve that those who are in charge of our state says, and some of our healthcare officials says, that we're flattening right now. Things look like it might be getting a little worse. And again, I sincerely hope that I'm wrong. Okay? Again, remember, we just had 47 deaths in 9 days. And at the rate that we've seen over the last 4 days, we will have at least 70 total deaths over the next 9-day period from Monday the 20th to Wednesday the 29th. You see the increase? This is simple. This is simple. This is the data. This is the facts. This ain't me. I'm not making this stuff up. You know, if we follow this, take the next 9-day period, the first 9-day period from the 10th to the 19th, which was Sunday, the next 9-day period from Monday the 20th until the 29th, Tuesday or Wednesday the 29th. If we take that 9-day period based on the numbers that we see right now, we're not going to have a 47-day death period during that 9 days. There'll be 70. And that's a very conservative estimate just based on the numbers as we've seen them over those 9 days, those other 9 days. It's getting ready to get bad, y'all. Okay? My friends, we are now entering into the beginning of the curve that our South Carolina politicians are claiming it is flattening. And the worst is yet to come. There's that storm out over the ocean and it's moving this old way. For sure. This is Hurricane Hugo on steroids. And people will be devastated by it. Again, the curve across the nation, the curve in China when it first started. It started with 1 death. And then it went slower, a couple of deaths, a couple of more deaths. Down the road, or a couple of weeks or whatever, started to increase. Then it got to a point where really, because this thing, you can walk around and communicate it to people for a 2-week period prior to having any kind of symptoms. So people are walking around talking to folks and communicating, shaking hands, hugging folks and all of this, communicating this virus and infecting people, and they don't even know they have it. And the people that they're talking to don't even know they have it. And people are being infected. And that's what's been happening. I mean, in North Charleston, when they said, hey, we need to start practicing social distancing, what happened in North Charleston? They said, let's have a St. Patrick's Day party. Yes, we're not going to have a parade, but we can still go party over on East Montague. Let's do that and drink some green beer. Some of them ain't going to make it. And some of them could be walking around right now with that Rona, passing it on to their loved ones. Might lose an uncle or auntie, granny or grandpa, or a friend or a relative or even a kid who might have an underlying condition that is weakening them and not allowing them to be strong enough to fight this virus off. This is real. This is the real deal. And here we are in South Carolina, just like there was one that started in China, There was one that started in Italy and Iran and in Africa, and there was one that started in Spain, and it lived for a while. Then it started to spike, just like in New York City, just like in Seattle, Washington. There was one case that it was just that one that started, and folks was like, "Oh, it ain't that bad." Then there was 3 or 4, and it was like, "Oh, it ain't that bad." Then one day it spiked up to about 9 or 10 that day. It was like, but it ain't that bad. No, it's just a flu. Then they looked up, and one day there was 50 deaths. Next day, it was 100 more deaths. Next day, it was 200 more deaths. And all of a sudden, now you got not this flat line, but now you got this spike, this curve going up, this spike going up, and the body count is going up. Why? Because people did not believe that it was coming. And now in South Carolina, we see people who are in charge of this state not believing that it's coming. And that's why they can do what they're doing. The worst is yet to come, folks, in my humble opinion. The worst is yet to come. And again, as I self-titled this live, I sincerely and truly hope that I'm wrong. I hope so. Because the pain and suffering that is what it is coming. Okay? Now, there are a lot of people who are affected differently by this virus. And I've talked about this before. And Maria, hey, how you doing? I pray that it's well with you and everyone in Chicago. Okay, take care of yourselves now, and that goes for everybody on here. Please protect yourselves. Wear your mask if you got to go out. Please, please. I'm gonna mention that a little later because I went Tuesday when they opened up the stores and everything here. I went out in my car. I didn't get out of my car, but I had on my mask inside of my car, and I took some film and everything of people at the stores. And man, folks don't believe it. They don't believe it because we ain't got in that spike yet. There was a point when the people in New York didn't believe it either, and the people in New Orleans didn't believe it either. There was a point until the body started dropping. Okay, they say this thing put the flu to shame. Okay, alrighty, but this thing actually is having a greater impact on the African American community than it is on any other community in the nation. And it has to do with the conditions in the communities that Black people have traditionally lived in, lifestyles, lack of opportunity. All of these things have contributed to a weakened immune system. It's known that this virus is actually looking for hosts or to infect those, and it does the most damage on those who have weakened systems. That's why the original thought process was it was affecting the elderly in the way that it was, and that younger people couldn't. But the thing is, though, younger people a lot of times don't know that they even have underlying conditions. They don't know that they have heart issues or blood pressure issues or different type of disorders or what. They don't know it. And so, and this virus is not about what you know. It's about what it knows. It's looking for that weak host and will invade there and take control. Alyssa, good to see you. Thank you. And it will invade whomever. Doesn't care. But it looks like that the African American community is suffering a lot more than any other community in this pandemic in America, in the United States. Why? Because of the communities that we've lived in, high density populations with poverty, many food deserts there, not being able to eat right, eat well because of the foods are not there. Then lifestyle choices that many times in our communities we haven't actually been eating well. Sedentary lifestyles, communities that are flooded with alcohol and drugs and cigarettes, right along with the fact that when it comes to healthcare, we don't have access to quality healthcare many of the times because we've been blocked through benefits packages on the job, poverty. All of these different things contribute to weakened systems. Okay. And this is known. This is something that's been known for a long time. And those who are empowered have refused to handle it, have refused to really address these issues. And now, because they've refused to, Black folks are paying a price for this. How big of a price nationally? How big of a price nationally? Although nationally, the Black people represent 17% of the population. Okay, 14% of the population, less than that. Black folks represent 14% of the population, but when it comes to death due to coronavirus, we account for 70% of the deaths. 70% of the deaths due to coronavirus are black people. And 65% of those are men. Let that sink in. Okay. Of course, some of the underlying conditions that we fight with as black people are, obesity, high blood pressure, hypertension, diabetes, what we in the community call sugar, These are underlying pre-existing conditions, many of which that we don't even know that we have, because as a community, and especially men in our community, we're like doctor shy. We don't we're going to man up and whatever. We're going to act like we're doing good even when we're not doing good. And all that's done is to open up the door for this virus to find a weakened host, okay, right along with the other variables. But at 14% of the population, and 70% of the coronavirus deaths, let's just look at the deaths that I talked about today. Today, we are well over 44,000 dead due to coronavirus. Of those 44,000, 33,000 of them were black people. And let that sink in. Out of 47,000, 33,000 were black people. And of those 33,000, 22,000 of them were men. Come on, somebody. We need to share this information out. Well, we got folks out here clowning around and carrying on and thinking this is a joke. And this thing coming straight for some of the brothers out there on the block. Coming straight for them. And if you think you're getting ready to go get some great health care, it's going to come a time, if this thing keeps progressing the way that I think it's going to do, they'll be doing exactly like they're doing in other cities right now that have really been overrun by this. They have to pick who's going to live and who they will work who they're going to work to help live and who's going to die. This one stays, that one goes. Just that don't waste your time. Let them go. And I'm not going to say how that'll pan out for black people. I'm just not going to say it. I'm not going to go there. Okay. All righty. But that's on the national level. So what about South Carolina? What about here? Well, in South Carolina, black people make up about 27% of the population. Okay. 27% of the population. But with the 150 deaths that we've had in South Carolina, and I think that number's fudged, I'm going to talk about that in a minute. Of the 150 deaths, we represent 57% of those deaths. 57%. Even though we're 27% of the population, we represent 57% of the deaths, okay? Out of 150 deaths, 105 of them were black. Out of 150 deaths in South Carolina, 105 of them were black, and 84 of them were men. 84 of those were men. Yep, that's it. Here's the numbers. Okay, so you don't believe me. Okay, reported COVID-19 deaths by reported race. Okay, this is in South Carolina. Okay, this is in South Carolina. 42% white, 57%. Yep, 57% black. 2% other. I'll leave that up to them. Okay, Kevin, what's going on, brother Musa? How you doing? All right, good to see you. This is the real, right? This is a DHEC graph. This is a Department of Health and whoever them people is, okay? The DHEC folks. This is their graph, not my graph. I didn't put this together, okay? And when it comes to gender-related deaths, it's from DHEC too. Reported COVID-19 deaths by gender. What does it say here? 56% male and 44% female. So I'm not lying, okay? I'm telling you the truth. This thing is coming particularly for men and particularly for African-American men. But that's not to discount the fact that our women, or the fact that others are dying from this thing too. We can't play with this monster. This is a monster. I said it on the last one that Governor Andrew Cuomo, in one of his updates, called it a predator. And I know he didn't mean it in the way that I've taken it. And it's kind of like like that predator from the movie, right? From the movie Predator. If y'all remember that movie, the bad guy, the predator in the thing was like this shape-shifting guy that could make himself blend in the backgrounds or become invisible and still attack and kill in horrible ways while invisible. Folks couldn't see it. How you going to fight something that's invisible? And that's kind of the way that this COVID-19 coronavirus works. It is a predator. I don't think Governor Cuomo meant it in that way, but that's the way my mind clicked to it, that it's this predator. It is this predator. And there's no doubt about it. And this predator is seeking anybody that it can infect. But because of the systems that we live in as African Americans in America, systems that have been neglected for decades and even centuries, it's the throwback all the way to slavery. And actually, there's an incorporation of white supremacy in this in this thing that I really don't have time to get into tonight, but I'll be glad to chop it up with anybody anytime you want to. But all of these factors have led Black people to a point where we live a life where without the full benefits of health care, and all of the things that others in America have access to. And that's weakened our system and allowed coronavirus to come after us more than anybody else. Okay, this is real. Miss B, how you doing? Good to see you. Good to see you. Dion, what's going on? All righty. Another candidate for office. Definitely good to see you. All righty. So that's the way the numbers pan out. This is fact. This is true. I'm not trying to sugarcoat this thing or trying to make it nice for anybody. Gina, what's going on? Good to see you. Ms. B, you always on time. Go ahead on with that foolishness, too, for sure. This week, because this is the irony of it all, this week, Governor Henry McMaster issued orders reopening public beach accesses and retail stores just 3 short weeks after he ordered them closed in order to slow down the spread of coronavirus. So 3 weeks ago, he said, shut everything down, okay? Shut it down, okay? Unless essential operations can stay open. I don't understand how gun stores and liquor stores and hardware stores became essential, okay? I don't know, but they said it was, okay? So, but that was just 3 weeks ago. That was just 3 weeks ago. And now all of a sudden, Monday, he lifted the ban on, actually last Friday, he lifted the ban on public boat ramps and landings. And then this Tuesday, a couple of days ago, he opened up our beaches and our clothing stores and shoe stores and department stores and jewelry stores and furniture stores and luggage stores and bookstores and arts and crafts stores and music shops and flea markets and florists and all of the retail outlets that were 3 weeks ago deemed non-essential and needed to shut down in order to curb coronavirus. He opened all of them back up and still is saying that we're in some kind of a shutdown. That don't sound like a shutdown to me. That sounds like business as usual. All of those joined those essential services, like I said, our grocery stores, which were necessary, okay? Our gas stations, of course, necessary, okay? But also our hardware stores, liquor stores, and gun stores that, in my opinion, should have been shut down also, okay? And who knows? Who knows? Tomorrow, he just might get a go-ahead for hair salons, barbershops, and gyms to reopen as well. So what kind of defense against coronavirus is this, when it's proven that the best defense in fighting this pathogen is through sheltering in place, social distancing, staying at home? Then add to the fact that they said, okay, we got some stimulus money we're going to give everybody, even though we're telling you to stay at home. We're going to give you this money right before we will open up the stores and everything. Stay at home now, but don't you come out now. But we're going to give you this money. This money going to hit your accounts as we open up stores. You think people getting ready to stay in? I can't speak for all folks, but I sure enough know black folks ain't getting ready to stay in. And I went out on Tuesday. Like I said, I didn't get out of my car. I stayed in my car. And I just took film and pictures. And I'm not going to show the films or the pictures, because you can actually do it yourself. Go out and just stay in your car. Stay in your car. Look at the stores. Shopping carts full of stuff. Folks ain't went, and I don't want to hear nothing about the social distancing requirements and wear masks. The governor is saying that we're doing a great job of social distancing. Mayor Summy said that we're doing a great job of social distancing and wear your mask when you go out. Man, I've been out there, man. I guess, when you got to know this, you got to go on out there. I've been out there, man. Folks are not wearing masks and they not social distancing. It's business as usual. And that's why I believe that there's a storm moving this all way. And that storm's name is COVID-19, coronavirus. And it's going to tear up something when it get here. I strongly believe it. And when I stop and I listen to McMaster and his order to open this thing up and the fact that he just don't get it, and we have healthcare professionals here in this state that are not telling him correctly, either that or they're telling him and he's ignoring them, that just wait. That's all you got to do. Just wait. Because if you don't wait, people might, that's a big word, might be killed. Instead of thinking about the economy. One thing about the economy, dead people don't spend money. Let that sink in. If we have a major spike, I would say when we have it, because I just believe it's coming. When we have a major spike, folks ain't going to be going out there spending no money. They're going to be running around talking about who's next. I look at my timeline now, and every day there are people dying. Some of other causes, but a whole lot now because of coronavirus. And remember, 70% of coronavirus deaths are black people. Black people. We getting hit the hardest by this thing. And we got McMasters and other people just dropping the guard and saying, oh, go on, it's all cool. If we flatten the curve. How you going to flatten something you ain't never even had? We ain't even had a curve yet. And you done flattened it. So what they're going to do is they're going to try to do damage control retroactively. Retroactively, when it comes to the coronavirus, COVID-19, retroactively means people have died. There are dead people. Now we're going to try to do something. Because we denied the science, we didn't believe it. And we just didn't do the simple precaution of saying, maybe, just maybe, there's something else coming. Let's wait. Let's wait and see. Yep. They trying to kill us. They trying to kill us. And just understand this, even though black people are more impacted by this than other nationalities right now, as we interact in stores where people are not wearing masks, as we're talking to one another out in the streets or whatever, hailing everybody and things like that, everybody is liable to be infected by this virus. Everybody. Because it's one thing about pre-existing conditions and underlying conditions. There are many times that we don't know we have pre-existing conditions and underlying conditions. And that's not an excuse that COVID-19 coronavirus takes. Oh, I didn't know I had it. Oh, COVID-19 says, so what? I'm going to take you out straight up. You should have known, So we as a people, we need to make sure that that we are being cautious. We need to be aware that this is what's happening, that there's a potential for a storm to be out on the ocean. Not a storm like a hurricane that we can track as it's coming in, but a storm that will have no warning for any one of us. It'll just be there. One day we'll be fine. They say this thing come on you so quick that, your person was fine one day and the next day they had a little scratchy throat. Next day they was in the hospital and a day or two later they were dead. Okay? That's how lethal this thing is. Okay, how deadly it is. So we need to protect ourselves. We need to make sure that we're doing our hand washing frequently, 20 seconds minimum, with soap and with water, Sanitize when you have to, okay? When you're out or whatever, sanitize and you're not around water. For those who have these impure water systems, like in Denmark, South Carolina, I don't know what to say. I don't know what to, I can't do anything but pray for you, for sure. Because you have water that's got dirt coming out of the faucet and you're supposed to wash your hands with that. I don't get it. I don't get it. And this state could have addressed that a long time ago and done something about that a long time ago, but they just neglected it. Why? Because it's poor people and black people involved. The same reason why they neglect a whole lot of things that have us in the predicament we're in right now. It's crazy. It is crazy. But one of the other obvious problems that we have in this whole situation is the fact that and this is an opinion, okay? This is an opinion. I think, this is what I think. I think, first off, that the South Carolina system, okay, the system, that means, when I say the system, I mean like governor, certain legislators, city leaders, some of our healthcare professionals. I believe that this South Carolina system is downplaying the number of deaths that we have here in South Carolina. That's first off. I believe that there's been more deaths than 150 in South Carolina. They just ain't been reporting them because they don't want the public to know just how bad this is right now. It's some kind of game. It's the sweet tea game. Sweet tea South Carolina. Everything is Gentile and sweet and everything. When the reality is South Carolina is ugly as it comes. And so I really, truly believe, though, that there are deaths that have been occurring due to COVID-19. And the reality is that these deaths have been covered up by possibly ordered by the governor or whatever. But I don't know. And I can't prove that right now. But I really do believe in my heart of hearts that this is worse in South Carolina than what they're reporting. And one of the reasons why I believe that is when I look at the media, right, at our local stations. I don't know if y'all watch the local news or whatever, but when it comes to the report on coronavirus, all they ever talk about is the cases. You might get a sentence at the end about the number of deaths. You might get a sentence at the end about the number of deaths, but it's all about the number of cases. Cases. And that's all you hear from the media here, not the number of deaths. And I wonder, why is that? Have they got the word from the governor? Hey, look, we don't want the people to get off, to think this is as bad as it is, so because we need to open up these stores and everything. So let's water it down. Let's get some sweet tea out there, some sweet tea coronavirus out there, Let's get that kind of media out there. Some fake news, and downplay it to the public. That's the first thing I really do believe, and I think. And the second is something that I think also. I think that the deadly impact that the coronavirus is having on black people in South Carolina is being downplayed too. I seriously believe that the direct input that this is having on black people is being downplayed in South Carolina too. Okay, I went to the DHEC, the South Carolina DHEC, the Department of Health and Environmental Control. Okay, I got it right that time. Okay, y'all don't hold that against me, please. I went to their website, and under the spot where it says, "Are you at higher risk for severe illnesses?" This is sort of like a commercial I saw too, because the commercial I saw it talked about everything but black folk. It says the DHEC website. It says, "Are you at higher risk for severe illness?" Now I'm gonna read through it. Okay. It says, COVID-19 can cause mild to severe illnesses. In most cases, the illness will be mild. However, some individuals are at greater risk of severe illness. As we learn more about COVID-19 as this outbreak progresses, one of the key things we have learned about this virus is that older adults and people who have serious underlying medical conditions, such as heart disease and diabetes, are at a higher risk of severe illness from COVID-19. Adults aged 65 and older should take extra precautions. Did you hear him say black people in there? 57% of the coronavirus deaths in South Carolina is black folks. Okay. 70% nationally, black folks. Did you hear them say one-time black folks in there? No, they said this. Okay, here the people that are really at risk. Got to look. Pregnant women, they got them named. People with asthma, even though they don't say that asthma has a very, very high rate within the black community. They don't say that. Okay. Then they say people with HIV. Those three areas they named also. Now, when it comes to HIV, South Carolina, and these are old numbers from like 2017, okay? South Carolina ranks 11th from the top, okay? 11th worst among the states for HIV, with an AIDS case rate of 15.8 per 100,000 residents. And this was in 2017. And of those newly diagnosed with HIV, 66% were African Americans, 22 were white, and 8% were Hispanic. Now, what I just read off, that's not there on the website. Neither was what I said about asthma victims, asthma patients, African Americans with asthma. That's not on the website. On the website, it says, okay, after it says adults age 65 and older should take extra precautions, it says pregnant women, people with asthma, people with HIV. And then it says other individuals with increased risk for severe illness include those who are charged with caring for a family member, friend, or neighbor who is at greater risk for becoming ill are asked to follow information provided by CDC and DHEC to safely provide this care at home. No mention of black folk whatsoever. And we clearly, it said, are you at higher risk for severe illness? That's the title of the page. Why don't it just say black folks on there? And then give the numbers. I don't understand it. But then again, maybe I do. Welcome to the New South. Black lives don't matter. Once again, black lives do not matter when it comes to this system that we live in, that we're operating in. And like I said, I've seen commercials when they talk about the highest risk and everything, and they talk about older people and people with, immune system deficiencies and things like that. And they never say the simple term, and black people is coming for you. They never even add that in there as if because it don't matter, I guess. It's crazy. It's crazy. That's right. Bronchitis, cardiac illnesses. That's right. Cardiovascular illnesses and everything, which we as African Americans, that's our wheelhouse. That is our wheelhouse. All of those illnesses. But instead of them just coming out and being forthright about it, I heard Mayor Summy mention it in one of his little 7 minutes or 5 minute Facebook things that he does, and one sentence. That was it. And we know that we have there's a greater impact on the African American community. But our sanitation workers and this, that, and the other, and gone on somewhere else. That was it. That was it. Folks, that's why I do this. So we can get the word out to black folks, that we can get our white allies to understand where this is at and why this is happening in this manner. And this ain't nothing new. This has been happening. That's what spurred on the Black Lives Matters movement. Straight up. Law enforcement officers who, for whatever reason, decided that black folks didn't need the same treatment that white folks was getting. Ultimately, black lives didn't matter. And that's where it all got started at. That's it. So, to my brothers and sisters out here, black folks, this Rona is dangerous. It is dangerous. It is deadly. Then you couple that with stimulus money and opening up stores. This is a deadly combination. And for everybody, this combination is going to drive that curve up to a spike within, and this is my prediction, within the next 2 to 3 weeks. Between now and May 15th. If I'm wrong, I'm going to come back and say so. And I sincerely hope that I'm wrong. I'm going to come back and say so. But between now and May 15th, I believe that the COVID-19 coronavirus storm is going to bring on a wave of pain, suffering, and death like the Low Country hasn't seen since the Spanish flu pandemic of 1918, when 64,000 South Carolinians died between 1918 and 1919, while 675,000 total died in the United States. It's coming. Get ready. And again, I sincerely hope that I'm wrong. Oh, yeah. And even in that pandemic, 102 years ago, guess who took a major brunt of the deaths during that toll? Black folk. Black folk. Yep. Due to the same reasons. So, my friends, I'm going to end this about now, and I thank everybody for coming on. Please share this out to folks. Ask folks just to watch, or to listen, or to listen for a little while and just, believe. And overall, though, I just say keep watching. Keep watching. If the national numbers and the numbers in the state continue to tick up, that means that we are not flattening the curve. It's just that simple. When we start flattening the curve, the numbers will start to go down. And then there's a whole nother thing, because once it starts to go down, you have to keep up the pressure. You can't drop your guard. We can't say because we're up by 30 points in the fourth quarter that we can just do whatever we want. No, we got to play defense and offense and everything else if we're going to still hold on to that lead. We can't get the lead and then give it back because we decided to lay down on the job. And right now, this is reckless and dangerous what's happening in South Carolina. It's reckless and it's dangerous, and people are going to die because of it. And again, I sincerely hope that I'm wrong. But if I'm not, y'all take care. Have a wonderful evening. These are trying times we're in, but I do believe that we will get past this. Okay? And it's all in how we go through this storm, how we will get past. Will we learn anything? Will we grow closer together? Will we appreciate one another more? I was going to talk about one of these times about our social justice community, because we're just not working together. Will we start working together for the good of the people and leave our petty differences and our agendas at home? Will we in our family lives, will we grow stronger as parents and as children? Will we use this as the reason that we've been looking for a long time to build a bridge instead of tearing down our lives together? And will we use this as a time to just make a change in our lives, to stop going down that path of self-destruction and community destruction and turn it over to community building and relationships that need to be built within our community? We have to decide. We have to decide. I wear my brother proudly. Yesterday was his birthday. Would have been his birthday. But this system took him. It's time for us to stop letting the system take our people. And I don't care what color the people are. It's time for us to stop letting the system take our people from us. And right now, what's happening in South Carolina under McMaster, what's happening in the White House under Donald Trump, they're doing nothing but taking our people from us. It's time to stop that. Hug somebody at home that you know, your loved ones, please. Okay, only your loved ones. Okay, don't go out in the street hugging nobody. Okay, hand wash. Only go out if you have to. Okay, if you got to go to the store, don't go to the store every day. Okay, once a week or once every other week. Get enough stuff. Okay, if you have to go out, wear a mask. The mask, it shields you from anybody that might come near you or cough around you or whatever. It stops the particles from getting in. And then if you're walking around and you got coronavirus and don't even know it, it stops you from infecting somebody else. And make sure that if you're wearing it, that it covers your nose and your mouth. And your mouth. It's not doing any good. You got the thing is under your nose. You still breathing in whatever's coming around. That's not how it works. You can still get sick and die, okay? Or walking around like it's some kind of a fashion statement. You got it hanging off under your chin and everything. I'm cool like that. I got my mask, okay? Yeah, until you breathe in some of these invisible droplets and you wind up at the emergency room, and that's the last time you see your family before you see your makeup. Think about it. Show love. Love is that great equalizer that's going to get us beyond all of this. And if we don't come out of this thing knowing that it's love that will make us all better and stronger, then we don't have any reason to even come out of this. This thing, it might as well just wipe us out totally if we don't learn that love is the only answer that's going to make it right for everyone. You all take care. I love you all so much. And as my good friend Deborah Powell Anderson says, I love you, and there's absolutely nothing you can do about it. Y'all take care. God bless, and we'll see you soon. Peace.